Hi guys, so today is gonna be about how a normal healthy TMJ will look like on CBCT. And first of all, before we get into the characteristic of all of these, I would just like to address how we should look at the TMJ. The correct angle for both CBCT and MRI should be sagittal oblique and coronal oblique. So right now, let's just look at the CBCT of a normal healthy condyle. On the left, we have a sagittal oblique cross sections, and on the right, we have a coronal oblique cross sections. And what we see on the left is that the cortical outline of the condyle in the neck of the condyle is very thick, and this gradually tapers off into a posterior hypocontour. It is also similar in the anterior part, which this one also tapers off into the anterior hypocontour. The articular surface is convex. It is covered with a very thin cortex. And this is actually very strange because this part is subjected to a lot of loading. This thin part is actually a sign that the disc and the fibrocartilage is just doing its job. If there is a disc derangement, however, or the disc is positioned forward, then we might see that this part is thickened. The cortical thickening is actually just a protective mechanism of the condyle, or actually a response to the increased biomechanical loading. The trabecular pattern here of the condyle should be uniform with no areas of sclerosis or low density. If you see any low density area, then this might indicate abnormality. So the TMJ does not only contain the fossa, the disc, the fibrocartilage, but also they have a fossa, right? And the fossa should be thick. This should be thick, it should be continuous and uniform cortical outline. The posterior slope should be rounded and smooth, and it should be gently sloping toward the crest of the eminence. The marrow space, of course, is a uniform trabecular pattern as well. Okay, and on the right, we can see right here the lateral rim of the fossa, and this white arrow point to the lateral and medial pole of the condyle. Lateral pole, medial pole. Okay, now this cross section just actually illustrate a visual exercise that can be done when we are evaluating the entire set of cross sections to determine whether the TMJ is healthy or not. Sorry, it should be like the condyle is whether or not the condyle is in correct positions to in relation to the fossa. So we can imagine this space, this joint space right here, filled with a biconcave disc that can fit in the joint space in the sagittal cross section. And imagine a crescent-shaped disc in the coronal cross sections right here. That's a tongue twister.